Okay, for our last two videos, we're doing external and internal rotation of the hip. For our external rotation, it's our deep rotator muscles. We have the obturator externus, obturator internus, quadratus femoris, piriformis, gemellus, superior and inferior. The origin collectively is at the anterior sacrum, ischium, and pubis, inserts in the greater trochanter area. The nerve is obturator S1, S2, and nerves to obturator internus and quadratus femoris. Okay, so ideally you would want to perhaps be kneeling or in a stool to preserve your body mechanics. So patient is going to be sitting, and to test for external rotation, you're going to be adding counter pressure on one side, on the lateral aspect just distally to the femur, and on the other one it's going to be right above the medial malleoli, and you're going to be adding resistance as they're trying to bring their leg in. Okay, so first try and bring your leg in just like that. Perfect. That's for grade 3. For grade 4 we're going to do moderate and then maximum resistance for grade 5. So grade 4, now just bring it in, counter pressure here, resistance here. Good. Moderate, and now maximum. Good. That's for grade 4 and 5. If the patient fails, we're going to go into supine. But before we do that, we're just going to do internal rotation right away since the patient is already here. For internal rotation, we have 3 muscles. We have the gluteus medius, minimus, and tensor fasciae lata. For medius, we have the origin of the outer surface of the ilium, inserts on the lateral surface of the greater trochanter, superior gluteal nerve. Same thing for minimus, superior gluteal nerve. Lateral surface of the ilium, inserts on the anterior surface of the greater trochanter, and last but not least, tensor fasciae lata. Origin is the anterior superior iliac spine, inserts on the lateral condyle of the tibia, and nerve is superior gluteal nerve as well. So to test internal, how we had our hand positions, we're now just going to flip them. So first, we're going to do a grade 3. Just bring your leg out. Perfect. That's a grade 3. For grade 4 and 5, we're going to add moderate and maximum resistance. Counter pressure on the lateral aspect distally, femur. Resistance is going to be pulling into external rotation. So bring your leg out. Ready for grade 4 and grade 5. Good. Now, to test for grade 2, 1, and 0, we're going to ask our patient to lay on their back or supine. Okay, so for due to gravity, the limb usually goes into an external rotation already. So to test external rotation, we're just going to ask the patient to just rotate their leg out like so. Good. And palpation is going to be quite difficult due to the muscle origins. For internal rotation, you're just going to ask them to rotate their legs in like so, and palpation will be also difficult because they're in supine. It will be difficult to palpate any of the muscles. You could palpate the tensor fasciae lata and the gluteal for internal, but for the deep rotator muscles, there's no way for palpation. For one, you're just looking for a trace of contractility of any muscle activation. For both internal and external rotation, if it's a grade 0, that means there's no contractility of any muscle due to paralysis. Thank you very much.